The term orthopedic impairments is defined by the Individuals with Disabilities Education Act, IDEA, to refer to conditions that we call physical disabilities or physical impairments that adversely affect a child's educational performance. Individuals with orthopedic impairments face challenges due to the functioning of their bodies. Orthopedic impairments include two major groups of physical disabilities: neuromotor impairments and musculoskeletal conditions. Neuromotor impairments result from damage to the central nervous system. The result is limited muscular control. Examples of neuromotor impairments are cerebral palsy, multiple sclerosis, muscular dystrophy, polio, seizure disorders, and spinal cord disorders. Musculoskeletal conditions differ from neuromotor impairments in that the cause is not neurological. Examples of musculoskeletal conditions include juvenile arthritis, limb deficiencies, and skeletal disorders. About 1% of all students ages 3 through 21 served under the Individuals with Disabilities Education Act in the school year 2017 to 18 have orthopedic impairment physical disabilities requiring special education or related services. Cerebral palsy and seizure disorders are more prevalent than other conditions. Epilepsy is the most common neuromotor impairment encountered in school. An individual with epilepsy experiences seizures resulting from abnormal discharge of neurons in the brain. Knowing what to expect and what to do in the event of a seizure reduces stress for the teacher and reduces danger to the student. When planning for needs of students with physical limitations, the school nurse, special education teacher, and individuals' parents can be great resources. Cerebral palsy is a result of damage usually caused by insufficient oxygen flow to the brain at birth. It can also be acquired due to brain damage resulting from accidents, brain infections, or child abuse in the first few years, and results in severe motor impairments. Many individuals with cerebral palsy have impaired mobility, poor muscle development, and may exhibit involuntary movements, spasms, and lack of muscle tone. They may need braces to help support the affected limbs, and pillows so they can be comfortable. Limb loss results from a missing arm or leg and is one of the most common musculoskeletal conditions. Limb loss is a major impediment to normal physical functioning. Emerging technology, such as the use of robot technology, provides great assistance to individuals with missing limbs. Juvenile arthritis is a relatively common musculoskeletal condition that is usually chronic and painful. It usually develops in early childhood, affects joints and the function of muscles, and impacts attendance. Children with juvenile arthritis need to be able to move about in the classroom. Moving around the classroom and hallways may be difficult for individuals with physical limitations. All schools must meet the architectural codes required by the Americans with Disabilities Act of 1990 law and must be barrier-free in order to accommodate students who use wheelchairs. Writing is challenging for individuals with orthopedic impairments because of decreased motor control in their hands and extraneous movements. Assistive technology, AT, devices can assist students with the writing process. Available options range from no-tech to high-tech. No-tech ATs include changing how a pen is held, using a bigger pen, and using felt-tip markers. Light-tech ATs include dictating to a transcriber and alternative keyboards. High-tech ATs include touch screens, joysticks, and trackballs. If motor abilities do not include pencils or keyboards, some students can use speech recognition software to produce text. This software allows individuals to circumvent spelling and writing difficulties. If student fatigue restricts the activity of writing, word prediction software can help. The nonverbal reading approach, NRA, can be used in conjunction with any phonics-based reading curriculum. The three-step decoding strategy has been found effective in promoting word identification skills. It focuses on subvocal rehearsal and teaches students ways to decode unfamiliar words. Response grids can be generated and used in class in place of a bimodal response system that relies on a yes-no response or head nod. Response grids ask questions that lend themselves to answer options. They add response precision, are simple to create, and can be reused and adapted. Assigning frequent response-oriented homework can achieve the goal of providing consistent, steady proof about student knowledge. The homework assignments should be planned in advance, completed by students, require responses that are modeled, and be assigned regularly. Practice assignments and low-efficiency tasks that require little teacher support can be conducted outside of class or online. Assigning work online creates a flexible timeline, is time efficient, and makes available more time in class for critical work, such as writing. Educators face unique challenges teaching individuals with orthopedic impairments. Some individuals need special devices in order to perform simple tasks. Teachers who understand orthopedic impairments make important differences in the lives of the individuals they teach and their families.